Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today is world-renowned pediatric gastroenterologist, research scientist, entrepreneur, and author, Dr. Alessio Fasano. And he's here today to talk with us about his book, Gluten Freedom, a book that examines the groundbreaking roadmap to a gluten-free lifestyle, and also talking with us as one of the key speakers at the 4th Bioceuticals Research Symposium entitled Revolutionary Strategies for Complex Diseases. It's happening in Sydney, Australia, April the 22nd through the 24th. Good afternoon, Dr. Fasano.
Good afternoon to you.
As an author, where do you find the time to sit down and pen a book? Is this your first work?
So, to tell you the truth, writing a book for general leadership was something that was not even in my wildest desire and plans. It just really materialized out of necessity when there was so much confusion on this world of the gluten-free diet and who should or should not go on a diet and so on and so forth. And therefore, I took some time really to put my thoughts together, and it was a lot of fun. I mean, again, out of, the comfort zone for sure. But, I think that to paraphrase one of the comments that I got from one of the readers, it reads like a novel, not like a textbook. So I thought that was a cool comment.
You said you wrote the book out of necessity to dispel some of the confusion. Did you find that there was more confusion about the disease on the part of folks suffering from the disease and seeking help, or those who were trying to learn what the disease was in order to help patients, or was it a mixture of the two? And if it was a mixture, how did you combine the two mindsets, as it were, in order to pen a book that was useful to both?
Yeah, it was both, actually. It was both on the side of the healthcare professionals and on the receiving end from patients. Well, that was the most challenging part of the story, to try to be factual, to be, as evidence-based as possible, but also to be at a level that, a general leadership can appreciate, what the content of the book is, so they can really have some guidance on what became a very confusing landscape. Because, of course, now the beauty of being on a world of communication, and so no frontiers like the internet and so on and so forth, brings tremendous opportunities, but also a tremendous amount of confusion if somebody will eventually put something out there, profess himself or herself an expert based on their own personal experience, and that becomes, the word out there, and that's the end of the story. So that was very confusing. But again, I think that the challenge really also pushed me to think very carefully how to frame the book and what to put in the book in terms of information, and as a journey from historical perspective, how we'll end up to have to deal with this problem of gluten-related disorders, the rationale why gluten, that is a protein that it should be good for us because it's a protein for food, it can be so harmful for somebody, and what will be the consequences in terms of this encounter of gluten for people that may have the mega necessity to go gluten-free, and finishing up with what is in the pipeline for the future.
Now, Bioceuticals is Australia's leading provider of practitioner-only nutritional and therapeutic supplements. They're at the very forefront of evidence-based integrative medicine. Now, as the author of Gluten Freedom and also as a key speaker at the 4th Bioceuticals Research Symposium in Sydney, Australia, the 22nd through the 24th of April, your news research, the role of gut permeability in autoimmunity, will you be talking about only gluten-free diets as they relate to celiac disease, or are there other diseases that a gluten-free diet will affect or treat as well?
Well, again, of course, as I was telling before, gluten-free diets, and celiac disease, they are a no-brainer, and this will be used as the paradigm of the discussion. There's going to be some mention of other conditions in which eventually gluten may be, if not the primary, instigator, but a cofactor that can really drive the autoimmune process, and this will be discussed as well. And then I will expand, a little bit more about, nutrition in general and how a bad nutrition but eventually leads to negative outcome in a specific genetic background by, for example, influencing the composition of the gut microbiota that seems to have such a big role in our immunity nowadays.
Now, you founded the Center for Celiac Research and Treatment in 1996. Are we talking about the same facility when we're talking about the Celiac Disease Foundation?
No, in the United States, there are, celiac centers. So in other words, research centers, and then there are, association of lay people, association of people with celiac disease and so on and so forth. The Center for Celiac Research is one of the centers that it's an academic center that does, research, clinical care, and education. The Celiac Disease Foundation is one of these lay association of patients affected by celiac disease. So they are two different entities.
Titled Revolutionary Strategies for Complex Diseases, the fourth Bioceuticals Research Symposium being held on the 22nd through the 24th of April this year in Sydney, Australia. Our guest in studio has been one of the key speakers, Dr. Alessio Fasano. Key speakers including Scientific Director Dr. Mark Houston, Integrative Medical Experts Dr. David Perlmutter, and Dr. Andrew Heyman, and Dr. Deanna Minich also will be attending as well. It's been great having you here with us today, Dr. Fasano.
Thank you for having me.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.